I will be talking about how to assess the progression using the Humphrey field analyzer, and I will be emphasizing some of the points which Tripti has talked about and show you how we use the Humphrey visual fields to look at the possible progression in our glaucoma patients. Open kar lijiye. Okay, detecting visual field progression is a huge challenge. And differentiating, as Mona said, that progression from the test variability is complex. Test variability is unfortunately more in glaucoma, so it makes it more difficult to detect the progression. Comparison of just two visual field is most of the time very, very inconclusive. How can we detect the progression when we have the Humphrey visual fields with you? You can look at by subjective means, or you can use the statistical methods like previous speakers have mentioned, either using the global indices, or you can look at more sensitive methods like event analysis, trend analysis, or clinical trials. Most of the times we don't use the clinical trials data into our clinical practice because it is not feasible to use that amount of statistical analysis for the clinical practice. What we use is most of the time event analysis and trend analysis. If you remember these two, it is useful not only for the visual fields, it will be useful even for when you use the HRT and other things, when you look at the progression. So subjective means very simple, cost effective. It's just to look at the visual fields and try to say whether it is progressing or not. Unfortunately, it needs an expert to look at it. And the poor inter-rater and intra-rater agreement. Same expert may give two different opinions when they look at those visual fields some other day, when you look at subjective means. So as they said, you can use the statistical methods by looking at the mean deviation and PSD. Most of the time, like Mona said, that's what we look at is the mean deviation. Again, it is simple. Disadvantage is it ignores the detailed spatial information. It just looks at the generalized depression of the visual field. And event analysis, I will just emphasize again, it compares the single field to the baseline. So what happened in between you may not get. That you will get only with the trend. So that is the disadvantage of the event analysis. If you are looking at it, you lose the trend. And if you look at only the trend, then you will lose what is the event that happened at that time. So combining both gives more effective results. And as I mentioned, the trend is the pattern of change in sequential visual fields, and it gives a linear regression, and it is a simple method of estimating. The machine does it for you. You need not know how the linear regression is done. As long as you remember, the trend analysis compares all the visual fields in between also. And guided visual prognosis is the latest one that is available in Humphrey, which if you have that machine, you can use it for your day-to-day clinical practice. What is guided progression analysis? It gives both event and trend analysis, and it also gives a GPS summary in a single page printout. Number one is the baseline visual field. Again, baseline visual field should be accurate visual field without any effect of the learning curve effect. Then number two, it has a VFI plot like Tripti has showed. I'll talk about it. Number three is the day's visual field. So in single printout, you'll get all this information. So what is unique about the VFI index for calculation of the rate of glaucoma progression? Central points are weighed more heavily than those on periphery. And it supposed to reduce cataract contribution to the measurement of the visual field loss. And it gives a VFI index 90% and 81%. So easy for you to use this information even to explain to the patient what is happening in the eye. And it also gives visual field index for calculation of glaucoma rate progression. It gives a regression graph here, and it gives a VFI bar on the right side. What is regression graph? If you see here from 60, how the visual fields are changing, the percentages it gives. This is VFI index 40%, and how it has changed, it gives you with the age. It is 66 years and 76 years. what is the loss today, and it predicts what is the possible loss for the next 5 years. So you can also use this information to assess if you maintain the condition in that stage, how the rate of progression is going to be in the next 5 years. So that is the advantage of the VFI. And as I mentioned, you can use it for the interpretation and patient education, and you can also modify your treatment decisions. Let's go through it. It is the overview printout. If you see here, there seems to be fairly stable visual field, even if you want to compare subjective wise, looking at grossly. If you look at this, so it looks like fairly stable. Let's see what does the VFI says. You can see here. So in the last 7-8 years, with this amount of the visual field, you can see rock solid, stable glaucoma, and you can predict that even in the next 5 years, it's going to remain the same. Okay, let's look at another example. Even on the overview, you can see this is the defect here, this is the defect here. Suddenly you see significant change in the pen. So let's see what happens here. You see here, the slope is, regression is going down. If you continue here, what is the loss? From the 100%, it has come down to 70 and odd. Over the next 5 years, it can come close to 60. But we are not too worried, because if you look at the patient age, he will be almost 84 years at that age. So you need not be too aggressive. But the same thing in a younger patient, you have to be really aggressive. Let's look at an advanced glaucoma. You see here, quite significant loss, but looks more or less the same. And you see here, even though he had surgery, the pressures are stable. Almost in 7 to 8 years' time, the visual fields are stable. Probably it will remain stable the next 5 years. So let's look at one more example. Here you see again, there is some amount of fluctuation happening here. And if you see one square open, one square closed, that means this is the full threshold test, this is the theta. But on the VFI, it looks quite stable. Slow progression may not be vision threatening. Consider the patient life expectancy whenever you look at any possible progression. And whenever there is any intervention done, either modifying the treatment drastically like surgery, or adding a potent drug like prostaglandins, then if you think that the patient is maintaining well, please change the baseline. If you don't change the baseline, the slope will continue to show the deterioration. Unless you change the baseline, information will not be very valid. And always exclude non-representative exams. New technology always helps in identification of the progression. Always reconfirm the change, like Mona has said, be obsessive about it. It is always beneficial to correlate with your clinical observations. Nothing substitutes good clinical examination. Thank you.